Hello. What we're doing, as you may remember, every so often I like to speak with friends around the world. We've done that already with Tunisia and with Israel. And today we're talking with a good friend in Brazil, Carlos Antunes. Carlos was with Etihad a number of years ago, and that's how I first got to meet him. And now he's living in Sao Paulo, Brazil, where he is a regional manager for the airline Copa. Carlos, great to see you through Zoom.
Hi, Jim, and hi, everyone that is attending this webinar. It's a pleasure to be here. Pleasure to talk to you. Greetings from Brazil.
And I have to apologize to our listeners. I am at a home right now where they're working on the roof. So you may be hearing some hammering above, but I'll try to turn off my mute button as quickly as possible. So, Carlos, let's just start off by telling us what's going on in Brazil. There's been a lot of controversy about the president's position versus the health minister. I guess last Friday, the health minister was fired. What's the feeling about that on the street?
Well, there's a bit of controversy in regards to who's commanding the country and what's happening. Brazil, as you might know, is a federative state with 21 states, and governors have the power and the ability to mandate laws and to indicate the population how to behave in situations of crisis like this. We have a president, democratically elected, that is behaving totally contrary to the World Health Organization recommendations. He's participating in public events, gatherings, hugging people and kissing, and everything that he should maybe not be doing, like the images we are seeing right now. And then we have a group of 21 governors who are in effect upholding the situation the best they can. Some are more strict in regards to social distancing and quarantine. Some others are taking measures to keep businesses working and more relaxed. What we are living currently in Sao Paulo is a quarantine for the last 3 weeks. We are on a quarantine. It's been extended until the 10th of May. Basically, non-essential services industries are not allowed to work. Every kind of business that requires human interaction is not allowed to work. So we have people, we have pharmacies, and we have supermarkets that are open, adhering to social distancing rules like distance between the people, and where people need to wear masks and need to sanitize their hands when they enter into the businesses. Good thing is that supermarkets have their shelves full of products. There's no scarcity, stocks are full. Pharmacies as well, there's no lack of drugs. The only thing that is that some drugs are now required to have a prescription to avoid self-medication. And but for the rest, in São Paulo, people are at home, working home office. Schools are closed, which makes the life a little bit difficult for myself and my wife. For example, we have a kid of 2.5 years old that keeps going around the house the whole day. And pretty much after 3 weeks of isolation, that we go out just for the minimum required, which is supermarkets and groceries and pharmacies, we've gotten used to the new reality. People say that we take about 3 weeks to get used to a new routine, and that's what we've gotten used to. And this is São Paulo, which is the biggest state, the most important and economically most powerful. Other states in the Northeast, we don't have enough data to evaluate what the situation is in regards to infected and deaths. So what I'm talking to you about is something which is my reality in São Paulo, where we have a situation under control, which is not the same around the country.
So what is the situation in Rio, which of course is so dependent on tourism? Are are many of the hotels closed?
The tourism industry has been maybe the first one to be affected drastically, and it will probably be the last one to recover. I tell you this because my company, an airline company, has currently grounded all its fleet. We have about 105 aircraft. They're all grounded because of the fact that the governments have put in place restrictions in regards to frontiers and overflight. The majority of the airlines have been grounded or reduced their flights by a proportion which is over 70-80%. Hotels in the majority of the destinations, not only Rio, but the majority of the touristic destinations are closed to reduce their costs. They fired most of their staff, or they put their staff onto hibernation, which is mechanisms that they have to reduce pay and working hours, or leave, just leave with pay or unpaid leave. In Rio de Janeiro specifically, then the majority of the tourism-related businesses are closed, and they will be having some very, very difficult times to get back on business. There's no tourism, nor, of course, international. There's no international tourists right now, and there's no domestic tourism in Brazil right now. Beaches are closed, as you can see in the pictures. Law and order agents prevent people from accessing parks, which are closed. Public spaces are closed. Beaches are closed.
Let me ask you this. We're seeing in the United States now pressure really coming largely from the White House about opening up business again. Are you seeing that in Brazil? Do you have any idea when the shelter in place may end or at least be modified in some way?
No, we're still, I think, in the other end of the picture, which is closing down. We're still shutting down businesses and waiting for the curve of affected people to diminish, so that we can then take with precautionary measures, actions to open up the businesses. The biggest problem is that Brazil doesn't have enough tests to screen the population. So we actually don't know exactly where we are at in terms of the infection. How many people have come into contact with the viruses, have become immune, have built up antibodies, and how many still don't have these antibodies yet. So where are we at the curve of infection, which is typical to the virus?
What about your healthcare system? Is it sufficient? And I suspect there's quite a difference between the urban areas and rural.
Yeah, the state-funded healthcare system is, they're saying in the news, at about 80% of the intensive care units are occupied. So we're not at full capacity. We're at 85%. Of course, private medical services are not disclosed, but you can easily be attended if you go to a hospital or to a public hospital, to a public clinic. You can easily be attended on whatever you need. This is the situation in São Paulo. Outside, in the countryside, you of course have less means and less equipments. And again, the situation is not well known. We don't know how many people are infected right now, how many people are going after medical services because of COVID or because of something else. But you don't have a situation like in Ecuador, where bodies are left in the streets because they don't have anyone to take care of them, to pick them up. You don't have a situation, typical pandemic situation or horror situation or alarmist situation. Everything seems to be very under control, despite the mixed messages that the president is sending, his ministers sending, and the governors are putting in place.
We have just a few more minutes, and I want to take advantage of your knowledge of the air industry. I mean, you've spent your whole career. One of the questions that comes immediately to my mind is when we're talking about social distancing. I mean, airlines have done everything they can the last few years to squeeze us in planes like sardines. And yet now we're going to be expected to be at least 6 feet apart. And I think people are often surprised that airlines operate like grocery stores on such incredibly small margins. What are some of the plans that, say, your airline or others are going to have to take into account as we go into what may be the new normal?
Until a few weeks ago, most of the airlines were working on a project called densification, which was to squeeze a little bit more rows and seats out of an aircraft, exactly because of the low margin that the air transportation offers and all the external variables that can affect air transportation. So one more row or half a centimeter less of pitch on every passenger would give you one more row and another 6 seats. So you would have, you would split the costs, the variable and fixed costs among the number of seats. What we're talking about right now in terms of social distancing is that we actually don't know what we're going to put in place to bring back confidence to the consumer about air travel. There are companies, there are airlines that are already selling a reduced number of seats and have come up with a plan that maybe you have exactly one row yes, one row no, one row yes. They'll keep the middle seat open like on the premium economy or on the business classes of domestic flights. That's not 2 meters or 6 feet. But then again, there's other problems. If you're traveling with your family, your wife, with your kids, you don't want to sit separated, and you actually don't need to do that. So some other companies are selling a reduced number of seats. Let's put, for example, 25 or 30% less seats over the capacity of an airline, and then they will run an algorithm taking into consideration who's traveling together to sit them in clusters and to keep them isolated and apart from other passengers. But since most of the airlines are still hibernating, in process of hibernating or in process of planning restart, all of this is new. And we don't know how this is going to go around. Yes, sanitation is going to be a must, and that was already put in place weeks ago with deep cleaning of everything that is a contact touch point of the customer.
And so when you look at a picture like this, it makes you realize that airlines are going to have additional staff. Turnaround time is going to be longer. And as I mentioned earlier, I mean, your margins are going to be squeezed. So will we see, do you think fares by necessity will have to rise?
They might rise on one hand because the costs will increase. On the other hand, there is a scarcity of demand. People don't want to travel. And so initially it will depend, it will basically very much depend on the strategy that every airline will put together. At the end of the day, you can say, okay, I'm driving my fares upwards because my costs are higher, but then it will be the market to dictate the pricing position. If the other company, if my competitor is pushing prices downwards, I'm going to have to follow him. And sometimes we will need to operate at a loss, which happens sometimes in certain routes that companies, airlines operate at a loss, but globally, they are driving passengers around from point A to point B, and the profit is driven from this overall volume of traffic, but not necessarily the fares will go upwards.
Well, Carlos, I wish we had more time, and I really want to thank you. It's just been a very interesting conversation, and as we hopefully see a reopening, I'd like to be able to come back to you to really get your thoughts about the airline industry.
It was a pleasure talking to you.
And be well. Give my best to your wife, and keep that toddler under control.
I will. That's not an
Thanks
easy
again.
task.
Bye-bye.
Bye-bye. Have a great day ahead.
You too.